Hi everyone, Dr. Rich Castellano, the Smile Doctor here at ImageLift. We're here today with Cynthia. Thank you for letting us share your video. Today we're going to be doing some facial filler, and you've only had a little Botox in the past, but no filler before. Right. You're going to love your results. So we talked before about areas we're going to treat around the smile lines through here, a little bit in the cheeks, and that's our focus for today. Any questions about our goals?
No, sir.
Okay, very good. And you have a medical background too, and you've seen some of our videos, so when you watch the videos, what you see is what you get. You know how we take care of our patient, our attention to detail. Brittany has everything set up perfectly for me. Thank you, Brittany. And she's our camera person too.
You're welcome.
So Cynthia, can I ask, why was it that you wanted to do a cosmetic treatment? What inspired you to do a treatment?
Looking at my face and seeing all the wrinkles and sagging and all that stuff.
Got it. Well, you're in the right place. We take our before pictures, so we've got them out here. You can see Cynthia is a really good smiler, and we'll compare the before and after pictures. I like to see follow-ups that are around 6 to 8 weeks. I'm going to have you rest your head all the way back. Little cleanse on the skin here. For the physicians and students that are watching, I like to use Hibiclens and alcohol to cleanse the skin. It's very rare to get an infection after filler, but we still do the cleansing. There's no restrictions afterwards. I like to recommend that 5-minute massage 5 times a day for 5 days. So we're going to use the numbing medicine. I like to use lidocaine, and I like to use the little buzzer. So you feel buzz, pinch on 3, 1, 2, 3, pinch. Doing okay?
Mm-hmm.
Small, medium, big pinch, not too bad?
No, not bad at all.
Okay. Buzz and pinch, 1, 2, 3, pinch. Little pinch. And 1, 2, 3, pinch. Doing okay?
Mm-hmm.
Very good. We try and make it easier than the dentist's office.
The buzzing stuff.
Yeah, the buzz does help. 1, 2, 3, pinch. The brain can only focus on so many things at one time.
Mm-hmm.
1, 2, 3, pinch. And 1, 2, 3, pinch. Very good. Okay, I like to mix in a little additional lidocaine when we do for the Bellafill. I'm going to have you rest your head all the way back, Cynthia. So with Bellafill in the cheek, I like to stay 5 to 10 millimeters below the orbital rim. Above that, you feel a little pressure pinch. I'll use the Sculptra. Pressure pinch, pressure pinch. It will feel a little bit numb and goofy under the eye. So I'm feeling the orbital rim here, 5 to 10 millimeters below. I'm going to use half the syringe on this side, half on the other, and that will help with the anesthesia and local. You feel big pinch, little pinch, not too bad?
Okay.
Pressure pinch. We're also going to go laterally across the zygomatic arch to give a little definition and lift up. When we build the cheek, it does help us to soften in the smile lines. Everything's looking good. Thank you for watching. Thank you for sharing. We will help you raise your cosmetic treatment standards and show you how to do things the right way. Cynthia will pass the grocery store test today. If she walks into the grocery, no one does a double take. Of course, we're wearing our masks, so it's easier to pass the grocery store test nowadays. Twist, twist, twist to atraumatically advance. Shiver technique for fine amount of filler over a large area. Perfect.
Seems like we've done this before.
Say that one more time.
I said it seems like we've done this before.
About 20,000 times. Very good. You can already see it gives a nice little plumping to the cheek. So again, we're staying, for the physicians and students that are watching, I'm staying about 5 to 10 millimeters below the orbital rim. Now, I'm going to do just a touch more of the numbing around the smile lines. So you'll feel buzz and then pinch, 1, 2, 3, pinch. A little more tender here. Nice and easy, just some numbing medicine. Sorry, that's a little tender. Okay, let's take a little break. And then a little numbing across through here. Buzz and pinch, 1, 2, 3, pinch. A little numbing, a little pinching. And the lip also feels a little numb once you numb in this area usually. Very good. Buzz and pinch, 1, 2, 3, pinch. We're going to replace Bethany's battery, 1, 2, 3, pinch. Okay, let me give that just a moment. Let me see if one of them can hop in and give you just a little break. Is Miss Cindy listening right now? There we go. We'll swap out Yesenia to the rescue here. Thank you.
Hi.
Okay, so I did a little bit more than numbing medicine. Brittany's just changing the battery on her Papper. Thank you for watching. Thank you for sharing. If you're just now joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. If you'd like to get a consultation, give us a call. Feel a little bit of pinching here. This is an intradermal injection here. We get the frown lines, the breakdown of skin in this area, a little pinch. And now I'm just thickening the skin, pinch. Perfect. Everything's looking good. Feel a little pinch here? Not too bad?
No.
Little pinch there. Little pinching. Perfect. So Bellafill is a permanent filler. It's made up of 80% collagen, 20% PMMA. The collagen gets absorbed and replaced by our body's own collagen. The PMMA is permanent, and that's what patients want today. The most expensive filler is the temporary. We have to keep replacing it. So that's why patients want that longer lasting filler. You turn your head this way just a little bit. You doing okay, Cynthia?
Yes, I
Very good. We try and make it easier than the dentist's office. Or easier than getting a tattoo. Pinch. Bellafill is a little pinch. FDA approved for acne scarring. A tiny acne scar there that we can just, you can see how it plumps right in. You can tell, 1, 2, 3 pinch, if the Bellafill is going to help with an acne scar. If you can pull the skin and you see the acne scar softens a little bit, that's a sign, little pinch here, that the Bellafill may be able to help you. Okay, I'm going to do a little bit more to the cheeks, but everything's looking really good. I'm happy with what I see. And we do mix our Bellafill with a little extra lidocaine, makes it more comfortable, and it makes it a little less viscous so that it's easier to inject. team has everything set up perfectly, makes it very easy. Okay, so a little touch more in the cheeks here. You doing okay? Let's get you all cleaned up here. Just a little drop there. You got it. We got you covered. Okay. And you can see how when we smile, that is our model for what looks good. And Cynthia's got a great smile. We want to recreate that plumping of the cheeks.
Shirley Brett says your suit is amazing.
Thank you. We like to have fun celebrating this new year. It's going to be better than last year. Augmenting the zygomatic arch is really important for cheek proportion and cheek balance. So I like to pay attention to that. Everything's looking good. A little bit laterally here as well. Just enough, but not too much. Perfect. Okay. So I'm going to show Cynthia what we've done so far. Why don't you hold this for me? Can you see how it softens the creases here and builds the volume? So I think what I'm going to do is I'm just going to build a little bit more here in the cheek and then finish things up. Is that okay? Okay. One step at a time. As long as Cynthia's happy, then I'm happy. Say that again.
It feels funny when I smile.
It feels funny when you smile, but that's the numbing medicine. And that will go away. Rest your head all the way back. Pressure pinch, pressure pinch. So staying 5 to 10 millimeters below the orbital rim, that's the goal. And higher than that, I like to use the Sculptra. Just remember, a lot of people out there doing injections, many of them are beginners. There's a big difference when you've done 20,000 syringes, so you will have a different experience here at our office. And we'll teach you our ABCs of plastic surgery to keep you safe. A is the 4 areas that we address for the facial appearance. If we sag, we tighten. Lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. And the 4th area is better than everything else. That's our behavior, the 4 areas, and the B for boundaries. The rules of good plastic surgery: safety is always first. You must look natural, prevent future aging changes, and let's get as much improvement as possible. Okay, we're done with
It's a
the
Bellafill
filler.
and it's
And 5 minute, this is how you do the massage. 5-minute massage, 5 times a day for 5 days. You can pinch the skin. You cannot hurt the product. So you can pinch and press. If you feel a firm area, you can just massage. I'm going to do a little bit of the Botox Dysport Xeomin as well.
it's
Rest your head all
Bellafill,
the
and
way up.
Bellafill is permanent.
Go ahead and rest your head all the way back. And you feel buzz. Pinch on 3. 1, 2, 3. Pinch. With the Botox, I ask people to give it 2 weeks. Pinch. If they think they need another dose, pinch. Sorry for the pinch. Give it 2 weeks, because earlier than that, pinch. You haven't given it the full time to take effect. Pinch. Okay, now we're completely done. Hopefully that wasn't too bad.
Not at all.
You did great. Thank you for being a great patient, Cynthia. We didn't have to give her any warnings or anything like that. I'm just kidding. We don't give warnings. So it's a tiny bit puffy, tiny bit swollen. but you'll pass the grocery store test today. How does it look so far? Can you see how it
Yeah.
builds, it creases? Now you can look at her before picture. So she looks great before, but the creases are a little less deep, a little more volume in the cheeks, and most importantly, she looks natural, and we kept her safe. We're going to keep her from having troubles or problems, so congratulations.
Thank you.
I'll give you the hugs from here. You can do the ice. There's no restrictions afterwards. We'll do a 6 to 8 week follow-up. And thank you all for watching. We're on a mission to stop bad plastic surgery. We're here to help you raise your standards and do things the right way. Please share and help others raise their standards as well. I'll see you in the next video. Congratulations. Really look